to all participants, our audience, from many countries in the world, and good morning to all the different media that you have joined us in from various platforms, so whether it is from Zoom or Facebook Live. I'm Rula Inglesi-Lotz. I'm one of the two co-chairs of South African Academy of Science for 2020, and I welcome you to the third webinar of the SAYAS webinar series. Thank you all for joining us. I'm sure we will have a very interesting discussion. I'm sure of that because by looking at the inspiring and successful panel discussions we have here today that will share their experience and thoughts, I'm sure it's going to be a very interesting debate. There's some housekeeping rules. All audience is by default on mute, so don't worry about that. But we are looking forward to an active participation of our audience today. So please send us your questions, your comments in the chat box. And as the facilitator of the session, I will make sure, or I will try my best, to ask all your questions and to pose all the comments to the discussions. If you would like your input, comment, or question to be addressed to a specific person of the panel, please indicate that in your message, then we can do that. So August in South Africa historically has been devoted to, from the one side, celebrating the successes of women nowadays, the successes of women in the past, but also pay tribute to all those women in the past that have paved the road for us today. Admittedly, though, the road has been quite bumpy. So we had dangerous turns along the way. It's still a long road, but we are on the road and we're getting there. We're going somewhere. In 2020, particularly, the road became even more challenging for the whole world, with many people around the world still predicting that we have not seen the worst, the pessimists in the groups. Words such as coronavirus, COVID-19, PPE, lockdown, these are all part of our everyday discussions. And the effects of the months of turbulence have been harsh, particularly for low-income countries that were at risk prior to the pandemic as well. Similarly, women in science, women in academia, women in general felt the impact a little bit more. The balancing act that the women are requested to perform with all these different many roles they have became even more challenging. However, we are resilient. So women scientists have also participated, and some of them led the efforts in various fields in the combat, in the fight against COVID-19. And that's what we will explore today in our discussion. So we aim to focus not at only what COVID has done to women, although we will touch on that too. It's equally important and we should share these experiences as well. But also we're going to focus a little bit on what women have been doing against COVID and how women are needed in leadership, in all of these projects, particularly at these times, as their perspective and work can contribute significantly on the road to a sustainable future. So to start with, I will ask one by one our panel discussants to introduce themselves and their role in the scientific community, and as well some small opening thoughts to today's discussion. So I'm just going to mention the name of each of the discussants and then the discussion can take over. So welcome to all of you. Let's start with Dr. Damaris Matoke-Muhia. It's the quote of 2020. The one is, "Can you hear me?" And the other one is, "Please unmute."
Okay, thanks for the invite. Quite excited to be here today and looking forward to a fruitful discussion. Dr. Damaris Matoke-Muhia from the Kenya Medical Research Institute in Nairobi, and I'm a molecular biologist by training. I'm currently involved in COVID-19 response, more specifically in the testing and also in research-related development of the vaccine, and also trying to come up with new diagnostic tools that can be used in the control of COVID-19. Thank you.
Thank you very much. Now from Kenya, let's move ourselves back to South Africa. Prof. Salome Maswime.
Thank you very much. I'm an obstetrician and gynecologist. I'm also the head of global surgery at the University of Cape Town. I'm president of the South African Clinician Scientists Society and the World Economic Forum Young Scientist. And so my opening thoughts are really, you know, as more of us become leaders in science, you find as women, you find that we also attract a lot more women into science. And so the change really comes from developing science leadership amongst women.
Thank you very much. We're staying in South Africa. We're going to Prof. Amy Slogrove, that is also a SAYAS member. Good morning.
Thank you, Rula. Good morning, good day, everyone, wherever you may be and whatever time zone you are in. I'm Amy Slogrove. I'm a pediatrician and epidemiologist and at Stellenbosch University, and I'm based at the rural Worcester campus of Stellenbosch University. And as Rula said, I'm also a member of SAYAS. And so being in Worcester, the town of Worcester is located within the Breda Valley subdistrict of the Western Cape province. And as the COVID pandemic really started to escalate in our valley, in the Breda Valley towards the middle of May, I took on establishing and leading the COVID case and contact tracing pod for the Breda Valley, and fully redirected my and my research team's efforts to these activities to voluntarily support the Breda Valley Subdistrict Department of Health and our community during this overwhelming time. And so this has been, my main role has been very much at the telephonic front line of COVID-19. And sort of as I reflected on that a bit in preparation for this, realized that actually most of these voluntary pods that were set up in the Western Cape were largely led by women scientists. And I think we can maybe think about why that is and share a bit more in the later questions.
Thank you very much. I must say with Prof. Slogrove, I was waiting for her posts in social media throughout lockdown to get informed and get more interesting information from her case study. Just to continue, Prof. Cheryl Cohen. Good morning.
Sorry, the other quote is finding the unmute button. Good morning. My name is Professor Cheryl Cohen. I work at the National Institute for Communicable Diseases, based here in Johannesburg, South Africa, and I'm also a professor at the University of the Witwatersrand. I head the Center for Respiratory Diseases and Meningitis at the NICD, and in peacetime, before COVID, our center is really responsible for monitoring respiratory infectious diseases for South Africa, doing surveillance, responding to outbreaks, and generating data to guide policy recommendations for South Africa. And so when the COVID pandemic happened, that emerging respiratory virus really fell within our center. And so we really played a number of different roles in terms of the COVID response. We have a large laboratory in our center, and so our laboratory was the first laboratory to offer COVID diagnostics within South Africa. We identified the first case, and for several weeks we did the testing for South Africa, although very rapidly laboratory testing was expanded to the rest of South Africa. And we also ran a reference laboratory function, again, early on and even now, supporting countries throughout Africa in terms of COVID diagnostic testing. And we also have a strong epidemiology component where we really conduct surveillance for COVID and generate data and synthesize it and report it. And most of my time now, in fact, is spent coordinating all the different data streams on COVID that come into NICD and publishing these in surveillance reports and scientific reports, so that we can really be open and transparent in terms of sharing data on COVID. And then perhaps just to say, in terms of our research stream, we also have a big research stream. Really, we only do applied public health research, so generating data for policy. And our main focus is really on transmission of COVID, burden of COVID, risk factors for COVID, so that we can understand what's happening, maybe try and project forward what might happen, and why, for example, cases are going down. And then just lastly, I'm also a member of the Ministerial Advisory Committee on COVID. Thanks. And really looking forward to the discussion.
Thank you very much. Thank you. Data is something that every person out there, whether they were knowledgeable of the disease or anything else, we all have opinions about the data and what, if the data are true and if the data are not true and how much we should believe. So having a scientist working with actual data of COVID is very important. Next, let's go to Prof. Jennifer Thompson, a SAF member and OWSD president.
Hi, I'm also a molecular and cell biologist at the University of Cape Town, but I'm really here in my role as president of the Organization for Women in Science for the Developing World. We range from Asia Pacific through Africa, the Arab countries, and Latin America and Caribbean. We've got over 5,500 members, in fact 5,776 at last count, and we've recently done a survey of all our members to find out how COVID has been affecting them, both in their positively and negatively, and I'll be sharing with you later.
Thank you very much, Prof. Thompson. We're looking forward to hearing, to seeing your presentation and hearing the results of that survey in your members. And last but not least, somebody that needs extra coffee from Sayas this morning, Dr. Sandra Lopez-Verges. She's from Panama, and it's quite early there. So if you joined us earlier and you heard the roosters, they are the roosters from Panama this morning. Good morning.
Hello, good morning everyone. I'm Sandra Lopez. I'm a virologist, and I also do immunology of infectious disease. I'm the head of the Department of Research in Virology and Biotechnology in the Gorgas Memorial Institute of Health Studies in Panama. And I'm also a member of the Global Young Academy, like Rula. So we were also the first that had to put in place all the testing for COVID in our country. We also organized the decentralization of the test through the country. And we are the ones that test the specificity and sensibility of the different tests for molecular diagnosis, as well as antigen detection or antibodies, before giving the permission to use it in the country, for example, for private laboratories or for selling. And at the same time, we are doing research. So how long the virus that is detected on the people is infectious, if we can also observe reinfections or persistence. And we were the first ones to sequence the virus in Central America and one of the first in Latin America. So we are through sequencing, analyzing also the transmission of the disease. And anyway, it was really interesting because it's the first time we were using research at the same time that responding to an outbreak exactly at the same time. So I think this is something really new with this outbreak in most of the developing countries like us. So yes, I think we can discuss. I have a lot to say about women in science on public health and on the health front, because at least here in Latin America, we are the majority. So most of the health workers are women, but the people taking the decisions are men. So this is something interesting to discuss.
Thank you, Sandra, very much. That's indeed very interesting, that the decision makers, the policy makers are primarily males, but the ground workers, the health workers are primarily female, and how this interaction and how this align to each other. Thank you everyone for the initial presentations and the first thoughts in the topic. So I'm gonna start asking questions, and then we're gonna mix and match who is gonna answer, and we'll take it like that. So firstly, I would like to ask a more broad question: is what's your experience or what's your thoughts with the women's participation in the search for solutions in your own country? Are there any consequences, if they were invisible, let's call it like that, in the system? Were there any challenges? Has there been adequate support during COVID time for the women to really take part and be leaders in this fight against COVID? Was there adequate support by the institutions, by the system in general? In your country and in your experience, your field, were there any significant support changes to make sure that the gender equality remains during COVID? And I'm going to ask first Prof. Masuime for her first thoughts, and then we can continue.
Thank you very much. And I'll just give you a bit of background as well about the work that I've been doing. And so most of my research has been on pregnancy outcomes in women who have COVID. Also have been working closely with research groups that are looking at other reproductive consequences, access to care, pregnancy care and reproductive care during COVID, and also looking at cancers, gynae cancers, as well as, and working closely with people looking at breast cancer, seeking treatment during this time. And so I work mostly with women groups. All the research groups that I've mentioned have been mostly led by women, and the research group that I'm in, it's an all-women research group. So what I've found is that it's women, when women decide that we want to do this research, we want to take up this study, we are going to apply for the funding, then you start to get the gender parity, and you start seeing, women actually taking the lead and driving change. But opportunities are not thrown out there for women, and it's really works when we decide that we are actively going to do the research. And I think in some cases, of course, you may find that women are obstructed and things become difficult, and just finding the time now whilst you're juggling being a mom, being all sorts of activities, it's been more challenging for us as women to find the balance, because it's been a difficult time. But again, I'll emphasize it's the volunteerism and taking a lead and pushing the initiatives. And I found that where women do that, they are able to achieve a lot more. And I've seen that in some parts of South Africa happening.
So to get the comment, we are looking at intentional action by women. It's not that the opportunities are given. It's not that the support is broadly given. It's not that something has changed, really. It's women taking the lead and taking the situation in their hands, if we want to say it like that. Thank you. Very interesting thought, Prof. Masuime. Prof. Slowgrove?
Yes, thanks, Rula. I think maybe sort of continuing on the line of the sort of intentionality of what women have done during this time. I think what I saw, me personally, and then, realizing that across our province, is that there was actually this group of women scientists who sacrificed their own research progress and work during this time, and immediately took on roles of coordinating groups of people to do this, to support the case and contact tracing that was desperately needed. So I think there was a group of women scientists who had research teams that were already used to working together, that had systems in place for communication and just daily processes and things. And so we're actually really able to hit the ground running with taking on this task of supporting the very vital case and contact tracing that was needed to get the epidemic here under control. And when I thought about that, I thought, well, there are many men with research teams. Why was it largely women-led research teams that were taking this on? And I think it's part of that sort of old sense of that, you know, women will, whether they're mothers or not, it doesn't matter. Women will, after a near sleepless night, get up the next day and still continue to do what's needed to take care of the children, or to take care. And that women are more likely to get into the mud and get into the nitty-gritty and actually do the less glamorous work, even within research, than men, to be honest. Although, yeah, some people may debate that, but I think women are generally much more willing to get involved with the messy human aspects. And so I think from this perspective, women are also more likely to, women scientists, whether they're in doing even sort of groundbreaking leading scientific work, are maybe more likely just to see the human side, see the human perspective, maybe directly involved in that or not, but I think have an essential part to play and then connecting and reflecting that human perspective and the human stories back to these forums where decisions are being taken, and back to these higher levels that set the research priorities, that design the policies, that implement the programmatic solutions.
Wonderful. That's a very interesting perspective that you gave us about the women that decided to sacrifice their own research path and in a sense the time to do their own research, to go and coordinate and, as you say, take care, because that's another that's a perspective we haven't seen much in the media. We hear about how the women in general have taken a knock in publication submission or submissions for publications compared to their male counterparts, and how they struggle and they don't have time management and they've stayed behind. But this is another reason maybe that why women researchers, women in academia and in science might have another reason for not doing what they were doing pre-COVID. It's because we took care of our students as well, and the research teams, as you say. Very, very interesting. Dr. Lopez, same in Panama. Same situation in Panama, different that side?
Yes, it's really interesting what Amy say, because we are living the same. So the only research I'm doing currently is COVID research, and most of them is to answer the questions the ministry or the clinicians have to be sure what decisions we can take that are the best for the patient, or to take control of the transmission in the country. So all my research that normally I was doing on arboviruses or my master thesis students, all this has to be stopped because of COVID for now. And this is not something that at least most of, I don't know, I'm a researcher that really did it, only one maybe. So I think this is something that is interesting, that when we have different roles, for example, working in diagnosis and in research, sometimes we will put on the side what will be important for our measurements of production to us something that we think is important for the society. And I think women have another perspective that is really important, that is most of social science, at least in all countries in Latin America, is done by women. So because in the design of the response of COVID at the beginning, there was a social science were not taken in account, the women scientists from these fields has to take the lead by themselves, and they're the ones that really point what were the problems that we were having in Latin America that COVID made visible. For example, all the social inequities, how violence increased in the homes, especially against women and children. What was the effect of COVID on education? Because we are really young countries, but the level of people with education is, we have 60% of people that leave secondary school and the beginning of bachelor. So less than 20% of the people will be inscribed in the university, and only 10% of the population, at least now, are finishing the university. So this is all these really important points for the development of the country, with or without COVID. The women are the ones that point these issues and how we have to answer them. And something important also to say is at the beginning of the COVID response, the lead in the Ministry of Health was all women. And it was a really technical lead. So quickly, at one point, because of political and economic decisions, if they don't really follow what will be the road that people would like them to do, because they have to maybe open before that what they really think they should. So we changed ministry, and now the head is all men. And they're most of the time all men that are more than 55 or 60s. So this is really interesting how you change the perspective and how you change in 2-3 days. You were totally, the design of the response was totally changed. That is okay. But then also the communication with the people that were in the front also changed. So the communication with what the women were leading. I was invited in technical decisions, and I saw the Minister of Health many times. This new minister, I have never seen him, because he is not, so the lead is only really high. So there's no more contact between the decisions maker and the ones that are doing the response. So then there's some maybe technical problems or organizational issues that they're not seeing. And then of course it takes the response a little more complicated. Oh, now, anyway. So this is something that we should think. And this is something that people of course use a lot in the media, is that most of the countries that respond better, they were country led by women. I'm not so sure how you can really measure that through time, but it's interesting because the leadership is different. It's a little more inclusive, and it tries to see the different views and take them in consideration, even if it's not your views. And this is really different than the normal historical male leadership in America, where I made a decision, I'm the leader, so everybody has to do it. So this kind of leadership can be really important in some historical moments, but in the complex time of COVID, you really need to take in account all the science, and the most inclusive you are, the most important. Because, for example, here, the ones suffering with COVID is not only on the socio-economical level, but of course, the American Indians are having really big problems. And because they already were having issues with nutrition. And this for me is really hard, because we're the richest countries of Central America. We shouldn't be one of the most unequal in the world, but we are. So anyway, I think this is all the things where I wanted to say. I
very
think
interesting.
Women are really leading. They're the ones, they're almost 80% on the health system. So it's really high. So this is why I say really you can see that it's 80% on the front and currently 0 in the leadership.
In the leadership. Well, what I'm getting from the very interesting for us case study that you're presenting to us is the women leadership styles are more caring and more inclusive, without wanting to generalize that all women are like that, or all men are like that. So we shouldn't get into that debate. But what is also interesting from what you're describing is that we're talking about gender equality, and our discussion is about women today. But there's another element that I picked from your comment, and that's the element of youth. That in some senses, the needs of youth, the stories, if you want, of the youth are not fully told and are not fully considered, because the decision makers have certain demographic profiles. So that's something also to keep in mind. So before I proceed with more of the questions and discussions, I'm going to pass now to Prof. Jennifer Thompson, where she's going to present us the general experiences of women in science during this lockdown or restricted period, based on the review of the OWSD members. And I will leave the floor to her to tell us more. Looking forward.
Right, can everybody see my screen? Great.
Yes, we can.
Okay, so I'm going to rush through this a bit because we're running out of time. But what we have is, oh, how do I can't seem to move the screen. I've moved my, can you, how do I get to, my computer isn't going to the next slide. Edith, can you?
Would you stop sharing, then I can share it from my end and do that for you?
Okay, sorry. What we're looking at here in my slides is a comparison of the answers to the various questions from South African women in science and the rest of the world. So it'll be quite an interesting comparison if I can work out how to...
Stop screen share, then I'll do it on my end.
Oh, stop screen, sorry.
You can go ahead.
Okay. Okay, can you get it to the whole screen? Oh, you've got the wrong slides. There we go. Can you do it in full screen? There we go. Next slide. Oh, you've got the wrong version. Sorry, Edith. Move on. Move on. No, more. Oh, sorry, carry on.
Prof. Thompson, just a suggestion so that we don't, that we save time for the presentation. I can continue with the discussion with the panelists.
Well, it's the next slide is going to be where we start. Next slide. Okay, so this is the looking at what how women scientists have been negatively influenced. On the whole, these are the same. If you look at the grey slide, can you see my pointer? Edith, can you see my pointer?
I can't.
Okay, it's not working. So the top two influences are that they couldn't do experiments or field work or travel. But what is interesting in non-South Africans is they were not able to teach. And I think that is quite an interesting point because South Africa has paid a lot of attention to online teaching. And it's clear that this is one of the differences between the rest of the world and South Africa. Next slide. Okay, so the impacts here is mainly no lab access, which is the first one. The first green thing is both the same in both countries. But what is interesting in the South African one is South Africans were not able to reach their supervisor, which is the last dark green pointer there, the last in the histogram, whereas the other respondents found that they could reach their supervisor. So that is an interesting difference in access to supervisors. Next slide. And then the factors that are positively affecting their work. That is quite an interesting one because South Africans found on the whole, you'll see that in the histogram on the left, they're more positive respondents to the factors that are positively affected. And just to tell you what some of them were, they were able to gain visibility. They were able to increase their publications, I think more time at home to write up publications, and interestingly enough, more public engagement in the South Africans. On the all respondents, which are more than South Africa, is they were gaining skills and experience. That's the last green bar on the histogram. You can see that the other respondents are finding that they are gaining more skills and experience. That would be very interesting to unpack a little bit more. Can you carry on to the next slide? This slide was quite interesting. How equipped technologically were your organizations before and after the pandemic? So this is before, and you can see that the South Africans felt that they were well equipped before, but even next slide, more even afterwards. So that's quite interesting that South Africa seems to have been quite progressive in looking at their technological equipment, both before and now getting better after. Next slide. Next. Okay, so this is how you've been involved in your professional capacity as working in this field, and on the whole, South Africa is less involved in their own research, and this may just be a sample size. But you can see here in this blue bar, which is higher in the all respondents than in the South Africans, that that they are. In essence, that the other respondents are doing better in raising awareness and giving information out. So South African scientists are not, possibly just as I said, because of the sample size, not as involved in getting the information and awareness out to other members of the community. Can you go on to the next slide? Now, this is quite interesting. This is looking at specifics of statements about involvement. And if you look at the first response from South Africa, I stay indoors to save my life and the lives of others. I only travel when there's something crucial I need to attend to. So that's impacting us obviously a great deal. Next slide. Here, I'm just going to highlight some of what the others are saying, is that if you look at the first one, I'm conducting research on how women-owned micro, small and medium-sized enterprise will be able to survive and grow during the pandemic in our city. That is only coming through in the other respondents, and that I found extremely interesting, that they are getting involved in these enterprises and on the entrepreneurship. And if we look at the third one down in the purple, I'm presently working with my members on misinformation and disinformation on COVID. We are harvesting tweets within the country and across countries. Seriously important. And somebody mentioned in the last session, I think it was Sandra, who said, it's so important to involve social scientists. One of the first things I did when I became president of OST was to open membership to social scientists as well as to natural scientists, because none of us work in a vacuum, and we really need to involve the social scientists. Could you move on? Carry on. We're going to question 29. So just move on. That's it, thanks. What are the positive outcomes on the pandemic on your home and family life? And you can see very many people say, obviously, I have more time available to spend with my family, but quite interestingly, also, my relationship with my partner has improved, which is quite interesting. Next slide. Go on to the next 31. That's right. What is quite interesting here is in the blue, my mental well-being has been severely impacted by the pandemic in South Africa, not so much in all respondents. And the next one is the same. So the first two bars are about my mental well-being. And certainly in South Africa, that seems to have been quite a problem, whereas in the rest of the world, it doesn't seem to have been such a problem. Carry on. I want to go to question 34. there we are expanding on our mental health problems. And in South Africa, I obsess about staying safe. It's insane. And the last one said, it's made me feel more marginalized. I'm in a marginalized community, no resources, no money to get food basics, no unemployment. And if we look at the next slide, for the other respondents, quite interestingly, I've had lots of meditation reflections, which I find to be constructive, which is really quite interesting. And in the green one, it says, due to less distractions as a result of COVID lockdown, I've been able to do some critical thinking on my research work for better research ideas and concepts. So there's been a mix of positive and negative. And finally, if we can go to question, oh, that was the last one. So my point is that the differences in South Africa and the rest of the world mainly seems to be on the technological improvements, but also that everybody is finding that there are both upsides and downsides in their research. And that's all my contributions from our survey. Thanks.
Thank you very much. No, that's very interesting points, and I was making notes here for almost every question that you mentioned. It's some of the one of the questions, I think it goes and it clicks on what Amy said earlier about women that go into research teams, entrepreneurial activities, women that decided to spend time with regards to misinformation, disinformation, with regards to COVID. So it might have been a little bit of a trade-off with their research activities and research productivity, but they continuously being productive in other topics. I'm not going to comment into the partner relationship has improved, because that we need to sit offline and discuss that. And in some senses, what I get from the results from your survey is that the lockdowns and the COVID have intensified the already existing challenges. Mental well-being, problems with marginalized communities. There were comments that there were challenges that existed beforehand, and it's almost as COVID became a magnifying glass that went on top of these problems and showed it to us in the magnitude we should have seen them before. So thank you, very, very interesting results. I'm gonna go a little bit further now and continue on the same theme of women's participation in COVID and leadership, because we're touching all of these things, and you gave me the step to discuss the natural sciences versus social sciences. What is the leadership and the participation of women different in this type of scientific fields? Why, Sandra mentioned earlier, the all women advisory or the 80% women in the health sector. Why are some sectors doing a little bit better, in your opinion, in women participation and gender equality versus others? So let me hear the thoughts from Prof. Cohen, please. If I pronounce it correctly. I hope I haven't butchered all your surnames today.
Hi, yes, no, my name is fine. So it's been very interesting listening to everybody else's reflections. And I have to say one thing I didn't say when I introduced myself, is that I'm an epidemiologist. And the reason I want to say that is because if I'd said that a year ago, nobody would have even known what I do. But now this is the age of the epidemiologist. And COVID is
superstars now.
Exactly. Epidemiology and public health is suddenly in the forefront. And the reason I wanted to mention this is because, the area that I can comment on in terms of gender roles is really the area of public health, which is where I work. And certainly within South Africa, public health is actually to a large extent quite female dominated. Within our institute, for example, in my center, I have a laboratory team and an epidemiology team. Both are led by women. Many of you who are based in South Africa would have seen, certainly in terms of the media presence of our institute, a large number of the experts within our institute are actually women. And so I do think if we look sort of more broadly within medicine and in the sciences, public health is an area that has been, you know, women are perhaps overrepresented, and within our organization, certainly there are many more women than men. Obviously, I think as in many areas, as you go up the chain, men become more represented. So for example, at the top level, it's about 50-50, whereas where you go down, women might be 80% of the grouping. But I think, I mean, I was trying to reflect on why that is. I think it makes me anxious to make sort of generalizations about women and men and how women and men are, because you know, obviously everyone is an individual, but I do think perhaps some of the reasons why historically public health has been more attractive to women, and one of them, in fact, Amy's comment made me think of, is that it's not the most glamorous of professions. In fact, your public health has really been quite a marginalized area of medicine, and that's why I started off by saying I'm an epidemiologist, because suddenly everyone cares about public health. But I do think, you know, public health is really about working with communities in a collaborative way to prevent adverse disease outcomes. And so it's not particularly glamorous. And again, whether that attracts women, I'm not sure. I think another aspect, you know, is it for people in medicine, certainly it does offer a more controlled lifestyle in terms of your daily routine. And certainly for me as an individual, that was a consideration. I think if you do have children, and you are responsible for looking after them, it is much more difficult if you're working nights or working weekends, and that is an important consideration. Whereas public health, you certainly work the hours, but there is a lot more flexibility. I mean, I was also reflecting on a personal level. You will have heard that in my professional life, I really straddle the areas of public health and research. And I do a lot of research, but I primarily situate myself in a public health institute. And the main reason why personally I do that is because the world of research, especially medical research, I think is a very competitive and cutthroat world. It requires you to be very emotionally robust and really also to put yourself forward all the time in a very competitive way. And that is just needed because of this constant competition for funding and to support yourself. And for me personally, you know, I find that exhausting. I do feel in the public health sector, it's much more a collaborative environment where we're working together towards a common end, and it's not this fight for funding and this fight to be first and this fight to be in the front. And again, you know, not to generalize, but I do think certainly women are, I think often we're not as socialized really to be out there in that fight, and it's, you know, maybe more difficult or maybe more comfortable. In fact, I mean, and that's the thing. It's not like I can't do the fight. I just don't want to do the fight. It's much the feeling that one gets is really from working as part of a team to do something that we all see as of value. And you know, I prefer to work in that type of environment. I tried to look at the gender breakdown. Because I'm on the Ministerial Advisory Committee, I actually got the stats for South Africa, and I must say the South African Ministerial Advisory Committee on COVID is extremely well split. There are 51 members, 26 are female, and there are 4 special committees and 2 are led by women. And I do think, obviously, South Africa is in many ways a progressive country. I think there is certainly the equal split that does suggest that there was perhaps a conscious awareness in terms of also choosing the membership of that committee. And I think that is a good and a progressive thing. One thing I have noticed is that ever since COVID has become such a big thing, the whole environment in which I work has certainly become more aggressive, more competitive. A lot of, certainly respiratory disease is also not the most glamorous field, but now suddenly a lot of men and people have come out of the woodwork and are putting themselves in roles. So I've certainly found the environment much more competitive. And I do think the same shift that Sandra was describing certainly has occurred with COVID, where people have moved from one area to this area because they see that it's the center, and it does change the feeling of the environment. And then just lastly, I wanted to make one point, because I really enjoyed Jennifer's talk, and she made me think about, for me, the positives of COVID. And I must say, for me, certainly in my work, I really struggle with I have I have twins age 7 and my daughter's 9, and it is a challenge to balance one's children and one's work and giving everything enough time. And one of the real positives for me of COVID has been the lack of travel. You know, as part of my work, I'm required to travel a lot. It's really important. And yet, if you have small kids, it is non-trivial to have to travel. And, you know, I used to do trips. I'd fly that night to be at the meeting in Europe that morning, just so that I could have an extra night with my babies. And when you try and participate online on an in-person meeting, you really feel marginalized and excluded. And I think what COVID has shown is actually that it is possible for us to meet and collaborate online. And this travel is not necessary, all of this travel that we do. And I think it's really not considered. If you are caring for children, the burden and the negative impact within the world of science of having to travel, because otherwise it compromises your career. You know, it's been so difficult to put it forward, and I'm hoping that will be one of the sort of positive revolutions that come out of COVID, that we can stay at home if we don't want to travel and still fully participate. Because with travel, you lose the evenings and the mornings with your kids, and if you know, in those first years of life, those evenings and mornings, they really add up. So those are my thoughts, and thanks.
Thank you very, very, very much. So I get two things. Gender equality, again, that concept comes again. Gender equality is a conscious and intentional decision. You mentioned the distribution of male-female in the National Advisory Committee in South Africa, and that was your comment. There was a conscious way of making sure this exists. And I mean, South Africa, we are very conscious. We try to be as fair as possible and as equitable as possible. So the traveling, I haven't seen so many nods in the whole discussion from all of you while Cheryl was mentioning that. It's the post-COVID era that will make us think before we decide to travel and measure the benefits and the costs for its decision, because there is something about networking when we travel. Definitely we get things from traveling and from meeting our collaborators in other countries. But now we're going to be more conscious again about the benefits and the costs of every decision to travel. And every time we say yes to something that is proposed to us. Thank you very much for that. I think before I move to Dr. Matoke, and that's why I'm trying to now to bring the audience as well. There was a question specifically for Prof. Jennifer Thompson. Is there a particular reason that South Africans are struggling more with their mental health than the rest of the world? Is it linked to socioeconomic conditions? What do you think that might be the reason behind that?
Look, I'm not a social scientist, so I haven't really delved into this, but at the top of my head, what I think might be one of the reasons is, well, there are two that I want to mention. South Africa, compared with the rest of the countries who are members of OAST, is more developed. And as such, we tend to be more separate from the rest of our families. Whereas in the rest of the world, there's more family support. People are closer in their environments to grandparents and to family members. We're more isolated in South Africa, I think. And so we've got fewer support systems. And that's one of the things. Secondly, is that in South Africa, we are the highest country that is home to PhD students. You know, we give PhD bursaries, fellowships to women from developing countries. And a lot of the Africans come to South Africa. And of course, they're then isolated. So that obviously is a huge issue that is plagued the non-South Africans who are working and caught in South Africa during this period. And then another one of the questions or comments from a woman from Free State is talking about the abuse by the men in our community. South Africa is one of the most violent countries in home abuse. And that is definitely playing a role the lives of women in South Africa and obviously women scientists. So that's a very, very telling point. So thank you to the woman from Free State who pointed that out. Thank you.
Interesting thoughts, very interesting thoughts. Another more positive perspective of this difference is that South Africans do not mind responding in that there is a problem with their mental well-being. I hope we get out of the taboo of sharing our mental well-being and mental healthness issues, because that's the only way moving forward. But I know there are countries and there are cultures that prevent from people sharing most probably the impact they had. So it's also very interesting thoughts, Prof. Thompson. Dr. Matoke Muhia, if I do not butcher the surname again. So what is happening in Kenya?
Kenya is not any different from other countries that I've shared before. I think gender issues are rampant everywhere. We need to, one of the things that we've seen since COVID started, though those gaps were there even before, is that there's need to be very purposive on inclusion of gender, in making sure that women are included. Currently, we don't have structures that actually accommodate women involvement as far as leadership is concerned, in management, at management levels, at decision-making tables. What we see is male-dominated kind of leadership system. You can find that if there was, like if we use our Ministry of Health, yes, they're women, but they're at a level whereby if we analyze that kind of leadership, there's the first stage, second stage, they could be from the third layer going downwards. What I wanted to say is that to use the examples that we've seen over time, I've been working on malaria before COVID and other neglected vector-borne diseases. We could see that at community levels, women are the implementers. They're the people who make sure that their children's health is well taken care of, their husband's health is well taken care of, the family well-being is well taken care of. So if we borrow that example from community levels, what for me is that at management levels, we could use the same system. If they are so caring down there, they will be so caring up here. They will make sure our countries are implementing the right healthcare tools. The tools are designed to take care of the women, to take care of the men, and to take care of the children. So we should try and emulate what we see at community levels and bring it at decision tables. And here I'm thinking about designing tools, utilization of tools, and also implementation of those tools. I'm involved currently at testing of COVID-19. And what happened when COVID-19 came into Kenya, when it was first reported in the country, is that, and then our institution said that, oh, we like to now how people can work. COVID was not there before. We like to how people can work on COVID. The people who volunteered the most were the women, were the ladies at my organization levels. They were the ones who are willing to work 24 hours, to come to work, do the testing, come at night, do the testing, and make sure that the samples are worked on, results are produced, and all that. So that willingness to do extra, to do more than they are given or what they are required to do, really is an example that we should be able to have women at decision-making tables. We should have them at leadership levels because they go extra mile. They go beyond what it's anticipated, what is required of them. So if we can be advocates of structures that purposefully accommodate women, then we are going to see results that will actually impact our health system, our healthcare system, not only that, but also our communities and everyone around us. Gender equity and gender equality is very, very important, because what I've seen, like the PPEs that are designed, they are more masculine. the PPEs that are being used for COVID control. Some of these PPEs, some of them when you use, let's say the masks that we use in the labs, not only the ones that we wear at the public, you realize that maybe they are not designed to accommodate the feminine face. They accommodate mostly the masculine kind of, they're big, they're not fitting very well. So that's what the impact, the negative impact of not involving women when we are designing tools that they are intended to be used by fellow women. So in our countries, I'm happy that South Africa, you have inclusion of women at leadership levels. This needs to be advocated in the entire African continent, but also at the globe at large. Also, if we go by examples in management of the current pandemic, if we use countries such as New Zealand, where the prime minister is a female, we use countries like Taiwan, which recently has fewer cases reported as far as those who are tested positive and from mortality, those who have died. The president is a female. When we go down to Germany, which has in the European countries, which has had fewer cases compared to other European countries, the leader there is female. So using these examples, we can say that we have that strength, women have that strength, their general thinking is more robust. I'm not saying that the men's thinking is not the same, but there's certain efficiency that we see when you have women at leadership levels, using the current pandemic as an example globally, but also using the community as an example in implementation of tools. So finally to say is that if we are champions of that change, let's be champions also of change in those structures, change to accommodate female. Not only my thinking here is that our thinking, all of us, is not that we want to compete or outshine men, but we as the women will bring in that synergy to complement the decisions made, the leadership given, but also bring in the synergy that will push forward in the control of the current pandemic, but also in management of our health and healthcare system. Thank you.
Thank you very much. Very interesting thoughts. Do we have any comment from any of the other panelists before I proceed? Prof. Thompson, yes.
I wanted to raise something that Damaris mentioned, and that is, if more women were involved in leadership, there would be far less conflict in the world. I was invited to speak. There's a nuclear test ban organization based in Vienna, and they asked me to speak on the opening panel. And I said, why do you want me, a molecular biologist, as a host president? They said, if more women were in charge, we wouldn't need a nuclear ban treaty. So it just shows that the international organizations are beginning to realize that women make peace.
Well, I read on that point, I read recently an article that was saying that if we had more women involved in the leadership towards climate change, and we did that 2 or 3 decades ago, we might have had a different planet today. It's interesting to see it. And from what I hear today from all of you, it's this caring leadership and this caring approach that women use in everything they do. It's this saving the environment, taking care of all of this. So just for time's sake and to move a little, I will go into 2 things. The one is, we had from Damaris the lessons learned or not learned from previous pandemics. She mentioned, or not pandemics, but just disease outbreaks. She mentioned malaria, and she mentioned the women's role and how we could learn from how the women lead in communities and take this model and take it higher up in policy decision making. So I'm going to do the round with all of you, and I'm asking 2 things. The one is, what can be done? Okay, so in Global Young Academy, we have this, how might we, on the science leadership programs, how might we? So what's the next step? So we have seen the challenges, we're discussing the challenges, but what do you think should be done in order to have better gender equality in both decision-making and scientific fields? The society, and you can bring your own perspective, whether it is for your specific field or more general. What can be done? And also, what can we say to students, to emerging researchers that are starting now and they really feel it this year? Because we had a comment from one of the audience members that she's a mother, she has kids, small kids, she has to balance everything. It's this non-stop pursuit for balance, which personally I don't understand. But she's finding herself also comparing herself with her husband, and that her husband hasn't taken a knock in his career during the lockdown, but she did. And she feels like a constant failure because everything has to give up. So two sides of the question, and I'm going to make the rounds to all of you. The one is, what can we do for more women participation in decision making, in scientific teams, and in the different fields in academia? What can we do about that? And linked to that, what can we say to the young women, to the young researchers, even young males that listen to these discussions and they don't know how to position themselves? What can we say to these emerging scientists that feel these pressures? And let me start with Prof. Masrime and her thoughts.
Thank you very much. And I mean, this has been extremely insightful. And I think one of the things that stands out about South Africa is also the fact that there's a lot of women in research or science leadership. I mean, the president of the Medical Research Council is a woman. And so I think, just as you've mentioned already, that, you know, South Africa might not be facing some of the challenges with getting women in leadership because a precedent has already been set, because there are more women that are in leadership. And so it's the modeling of leadership that we see that attracts more people to become leaders. It's leading by inspiration. When we publish, when we go out and the world sees the work that we're doing, younger women want to join and want to follow. But of course, it's not easy, it's difficult. The balance is a struggle for all of us. And so having these honest conversations of, it's not perfect, I don't have the perfect life, I don't have it under control, I'm trying to, but I can't do everything. And so, and the mentorship, I've had some amazing mentors, and I think one of, you know, my most amazing mentor is a woman as well, a female professor that mentored me. And, you know, constantly trying to show me that you don't have to have it all right, and trying to show me like things like develop your niche, you know, learning that I don't have to say yes to everything, but I need to choose my field and follow that and build on that. So I think it's a whole, there's a lot we need to do, but I think inspiring, mentoring, modeling, those are some of the things, and just being honest with everyone, or with ourselves as women, about the challenges and the successes as well. You know, so I think a lot of good has happened, and I think COVID has opened up a lot of opportunities. But, you know, we need to raise up our hands as women and look for opportunities and take them. No one is going to give them to us. Sometimes it's the pursuit of leadership that puts people into leadership. And so we shouldn't be afraid of saying, I want to step into this position. Let's take the leap when opportunities come.
Thank you very much. Sandra, if I may come to you next, and then I will also throw something extra to your side. So emerging researchers and what advice we give to them, but also from a mothership perspective. So we live in an environment that many women think that they have to decide between being a mother or being a scientist. What do we say to this emerging researchers?
Okay, I think we are many women proving that you can be a scientist and a mother at the same time. That doesn't mean that there won't be a lot of challenges, and the challenges will be different depending on the moment of your career, depending on the country you are, and depending on the age of your children and the necessities they have. So I think this is where all of us are looking kind of a balance. And yes, and I think we need to think that we cannot have all maybe at the same time moment. I'm still trying to have all I like. It's not easy, and it makes maybe life more complicated. But also what you can see is you can, depending on the moment, you can divide your time differently. So there will be more moments that the family will need you because it's a crucial moment for the development of the children, for example, or one specific moment where you're struggling because you have had a really great opportunity and it would be kind of a shame not to take it, especially if you think at the end it can help others or it can make you a better person to do better your work, for example. So this is something that if us will have to choose at each point, that doesn't mean that some decisions you will say, oh, that was a great decision. Sometimes it's like, oh, I'm not sure that was the best one. So next time, maybe I will think of these specific things. But I really think that if you like science, you can do it. But what all of us will need to work on, because I think we try to show as models that is possible, and we try to have a positive message to young researchers. So I think this is good, but all of us need to work together to see which are the countries that have the best policies to have gender equality at work, which of these policies we can put in our cultural environment and in our own reality, and which things we have to create ourselves or innovate to respond that. And some of these things we will learn thanks to all these global associations. And an example, I'm still amazed of the flexibility some of our friends from Global Young Academy have as researchers of the time, how they can do so much work at home. We are really not allowed to do that. That doesn't look good here in Latin America. If they don't see you, they think you're not working. And on the COVID side, for example, for me, it was really hard on the family and for all my group, because I'm at work almost. So now I'm trying not to work too much on weekends, and this I'm lucky because I'm the chief. But if not, it was for 2-3 months working 7 days 7. So you don't see the children, and I was beginning to see some behaviors that were seeing it was difficult for them because they were locked down and they were not seeing their mom, or really few times. And I'm lucky because I have a partner that is really helpful. But here in Latin America, at least in Panama, more than 40% of the family is the woman with the children. The father is not responsible. The father doesn't really exist. So how all these health workers that are women or researchers do when they're the only ones taking care of their children? So you need policies to help these people. So you need childcares at work, and we don't have them anymore in Latin America. So most of the childcare is made by the grandmas. But now in COVID time, it makes them in a specific dangerous situation. So some of them leave the children with the grandmas, but not to make the grandmothers because they were in the front. They were not seeing their children for 2-3 months. So this is really hard. Or they have to fight. So this is, so I think this is a lot of things that we have to think, and I don't know if this is really specific to our region, that I don't know if it's the same, but I think we can be really positive. We can really do what we want, and we can really organize ourselves to do the best. And the only thing is to really take the opportunities you think will be good for you, and also always work in group and work with others. I think helping each other will help us, maybe to all of us have our goals, but maybe in a less tiring way. So not to try to do everything ourselves alone. And I think this is important. At least for research, it helps us to be collaborative.
Thank you, Sandra. So the message is it can be done, but it has its own challenges. But we need, if we love what we're doing, we are going to have to make decisions, and sometimes they are tough decisions, but that doesn't mean that if I decide this week that I will work more than I see my kids, it's a decision for life. Next week, it might be different, and during COVID, it was different. Amy, can we hear from your side?
Yes, thanks, Rula. Sure, there's so many things that Salome and Sandra touched on that I really relate to. So, I mean, I just want to kind of stress, you know, that need to be honest, that it is messy. being a mom and being a woman leader in science it is messy, and we shouldn't try and make the young women in science and even the young men in science think that we've always got it all together, all under control, because that's not the reality. And they're going to try and either expect that or strive for that when it isn't always possible. And I think really what Salome said about finding your niche, being strategic in the opportunities that you take. You don't have to take everything that comes your way. And I know it often is hard to make those decisions about letting some opportunities go by, but trying to find, you know, where you're really going to maximize the opportunities and maximize what you get out of that. And then something I wanted to touch on that's a little bit different. As a mom of a son, a boy, and I know Rula has got boys, beautiful boys too, and probably many others on the group. I think nurturing boys for the next generation is so important. I think boys are being left out. Honestly, I know young girls have got it terribly hard, but boys in South Africa, also young boys, are growing up experiencing extreme levels of community and interpartment household violence from a young age. And I think not including boys, young boys, and planning for their future, about the men that they're going to be and how they are going to be those supportive male partners, and the role models to other young men. We're missing a part of the solution there if we're not also going to pay a bit of attention to boys nurturing and boys mentoring and boys role modeling as well.
Thank you, Amy. The last point is beyond important. It's crucial for the future of gender equality, because we're discussing about gender equality. We are not alone. And we heard Sandra and Salome also mentioning at some points that it's also the environment we have around us, the groups that we're working with. And if we don't, as you say, nurture the future males, the future partners, then we are not creating a system where the women 20 years from now or 10 years from now will not sit around the panel discussion and have the same issues that we have at the moment. Damaris, can we hear from your side?
Yes, I think I agree with everyone else. One of the things that I feel that should be done is having that support system. This, when we look at our institutions, you realize, like, let me use mine as an example. You realize most of them says there's no issues to do with, not allowed. Sexual harassment is not allowed in my institution. All gender bullying is not allowed in the institution. But when you go back to implementation of that, when women at institutional levels are bullied, who do they report to, and where do they report, and how is that treated? I look at, I go back to that question. You realize that women go through a lot at institutional levels, and they don't have someone to fall back to. You realize they even go back to reporting to other men. And for me, it looks like we need to create a support system whereby women are that support system that is required. Women supporting other women. I used an example where recently we had a lady was informing me about how she's been bullied. And she thought, oh, being a young girl, I need to inform my senior lady at the institution level, who was a leader, who was a rector. So when she went to report, the first person to victimize her, or the first person to tell her how she's wrong, was that senior lady, telling her, oh, you wear tight things, the way your voice is not right. So what am I saying is that we need to create those structures whereby, even though we are championing about inclusion of women in leadership, we also need to champion being that support system that is needed in other young upcoming women scientists can fall back to, in a way that they can come to you, whether they're victims or they're the ones who have caused the problem, that they can come back to you, being that role model or being the mentor, in a way that you lead others, you lead other women, even the boy child as I'm talking. So creating those systems that support that. I want to go back to that issue of being a mother and having children. I'm also a mother and a mother of two. And you realize that you, apart from being a wife, apart from being a mother, you're also a professional woman. Balancing all the three becomes a challenge. But I know we are better organized. We have a way of organizing ourselves. And I think that's a strength that we need to appreciate. We have those organization skills, how to plan our day, how to plan activities, how to implement them. But one of the things we need to discourage ourselves is killing ourselves to be super moms, to be super professional women, from being super super wives. So in a way that don't judge yourself so harshly when you don't deliver on certain areas. Say that, okay, I didn't manage that, and move on. Because the moment as ladies, you go back by victimizing yourself, you first of all kill that morale to try again. So I think that part of having appreciating that, yes, I did well here and I didn't do well here, and not letting it psychologically stress you or psychologically bring you down from not trying again, should be removed. So I wanted to add that point, that we are not superhuman beings, that we should be able to do everything right. When we try and we are not able to deliver in certain areas, be it an area of being a professional or an area of being the mother or being the wife or being a nice sister there, you shouldn't judge yourself very harshly, because that's one of the things we did a survey, and you realize women, first of all, judge themselves, evaluate themselves before even they take a risk to do something. So you tend to remove yourself even from trying. So I think that kind of judgmental behavior or kind of mannerism should be removed from us in a way that, yes, you realize if jobs are advertised and maybe a job of an accountant, you look at your CV and you realize you have not met the skills and you don't apply. But a man who has done maybe they have done entomology or done something totally different, they'll go ahead and apply. So they become more of risk takers. We should get to a point that we can also take risks, venture deep to things that even though we look at ourselves and don't see that potential, take up assignments and do them. But also we shouldn't kill ourselves in trying to do things to please others or to set our priorities and just go for what you think makes you happy and things that you think you like to do. Thank you.
Thank you. Very important point. That women, we tend to reject ourselves before we even apply. We do that to ourselves, and again, generalization and maybe stereotyping, but the majority of us feel that way, and the majority of us needed a push of a good mentor, like Salome mentioned earlier, a good mentor, a good role model, and it's a responsibility of the role models to show that we, as you said, we are not superhumans. We have, maybe our kids think we are, but personally mine think that I'm Captain Marvel during the night. But we are not superhumans. We also make mistakes, and it's fine to share the mistakes and share the errors, because then the young generation doesn't think that we only do things successfully. we also trip every now and then, and we do it falling forward. Cheryl, can we get your comments? And then Thompson.
Thanks. I think, I mean, I wanted to start by going back to what Salome started with. I do think legislation and policy is the important first step. And I think, you know, South Africa is, we're in a privileged situation, I think, compared to many other low and middle income countries, but that's not incidental. It's because, in fact, we have an extremely progressive constitution that enshrines equality of women, it enshrines gay rights, and that didn't happen by accident. It happened partly because of the participation of women and marginalized within the struggle that led them to be able to then, when the constitution was formed, fight to have those rights put into the constitution. But what it at least creates is an enabling environment. And of course, the constitution is this big overarching talking about is getting down to policies at different levels within organizations. I think, and that at least gives one some kind of structure and framework to hold, you know, within which we can put ourselves forward. I think the second important point, though, is what Jennifer mentioned, which really characterizes South Africa. We have this progressive constitution, and yet we live in the society with huge levels of gender-based violence, with huge inequality in terms of gender roles, where to be honest, most women, especially within poorer communities, you know, every day is really a struggle against all of these institutional, entrenched structures. And I mean, and so I do think, and this is really not my area of expertise, but it does need to start at the level of education and even creating enabling environments for girls within schools. You know, just for example, the burden of having to go to school, be in school, and come back when you feel constantly unsafe, you know, at risk in terms of physical assault, for example. This is the reality for so many girls, and yet it's not measured, you know, that they're carrying all of this in addition to trying to do their science and trying to do their, you know, I don't know how we address these things, you know, but I do think there is we need the legislation, but we also need somehow to change our societies and what is acceptable in terms of how we behave, and that's the difficult part. I think the other part is about being role models. I think for young scientists, what is young women is to be able to believe that you can be that thing, and that's about seeing people, you know, women out there who are living, you know, living those experiences, and you know, so I think it is important also for webinars like this to create enabling situations where women can be out there and can be, and often it's, I mean, personally, I would much rather sit at home and do my science. And recently with this COVID, I've been forced to be, I've had to be do a lot of media. And the media is heavy, it's exhausting, but it's important, you know, for us to be out there and be seen by other women. I think, the last thing I just wanted to comment on, I think, and we all talk, and you can see everyone identifies with this, the struggle of being a mother and being a scientist. And I think one of the important things to me is also this issue of value and how we value the different roles that we fulfill. You know, I think society broadly, it values the science, it values the papers. I think certainly I have to balance my time between being with my kids and being at work. But I think one of the important steps in that is saying the time with my kids has as much value as the time at work. It's not that I'm somehow less, you know, when I'm spending, it all has value. We have to balance and do all these valuable activities and within our life, and staying at home with your kids is as valid a decision as traveling to the United States to attend a conference. And in the work sphere, really what we have to do is enough. And if at the end you decide this is enough and today I'm going home to be with my kids, that's okay, because being at home with your kids has as much value. And that those types of, you know, because I think those sort of child rearing is denigrated because it's the woman's role, but that's not the case. I think, you know, we work in different spheres, and if we can value them all equally, then we can also feel better about ourselves in terms of feeling that these different aspects feed and nurture ourselves, and they all contribute to the good that or the value that we're giving into the world. It's not like my work is this special thing, and my childcare is this other thing that I have to do because I'm a woman. Thanks.
Wonderful. I'm so agreeing with your last point, especially with the fact that we are not only one thing. We are many things, and they have value, all of them, because if the one wasn't good enough, the other one would get affected. So I completely agree with your point, and I see more nods from the panelists. Prof. Thompson, thoughts?
Yes, I'm actually full of hope in the youth. We need to involve the men. I opened membership under slightly different conditions, but for women, men can become friends of OAST as long as they share our aims. But I was very, very impressed with the first SAS meeting I went to as president of OAST. The topic was something about women in science. And I said in my talk, I said, look at all the young men. Have you come here to meet the women? And they laughed and they said, no, actually, we don't want the women in our lives to be treated the same way as our mothers and our aunts and our grandparents. So I have huge faith in the men, but we've got to include them. It's terribly important to get them to understand.
I have goosebumps from what you just said. That's crucial. That's crucial. And the men that have these values and believe in gender equality and understand the challenges of their mothers, that they don't want to be passed to their daughters and further on, they should not be the exception. We should live in a world that they're not the exception, that they are the rule around us. So I think for purposes of time, I'm just gonna, there is one more question that comes from the audience, and then we will close. Because I know today, all of a sudden, it's a day full of webinars. There's Wednesday full of webinars. We have the self-webinar later on, but it's I don't know, I don't want to go and attend all of them, and there's no time. Remember time, eh? So there is a question of what is gender equality? Is gender equality only about putting the numbers there? So do I have gender equality in my field when I have 10 male researchers working with 10 women researchers? If anybody would like to take on that. Just to close with this balance of males and females based on also Prof. Thompson's comment about the males of the future. Damaris?
I think one of the things that we need to be clear about is not giving jobs or opportunities to women just for the sake of being female. It's those moments where they are qualified, they have the expertise needed for the job, and making sure that they are considered when you're doing your selections or when you're giving a job opportunity. What the culture has done before is that men had more advantage of being employed or getting jobs. And you realize that going by that, they tend to recruit other men to similar job opportunities. So, and what we need to advocate for when we talk about gender equality is not like you have 5 women, 5 men. No, it's making sure that there is representation of gender in a way that we have female part of it who are qualified, who are fit for the job. And it will be unfortunate if you advertise a job and you realize there are no women or there are no men, and then you end up having an institution full of male dominated. It's unlikely if your purpose to realize that actually I have women who have equal qualifications as those male that you're looking for, and recruit them. So what we are looking for is fair representation, because culture over time has been very brutal on women in a way that's trying to balance our lives. Then you find we don't go for those top positions. But now we have women who are aspiring to be top leaders, who are aspiring to be presidents of countries, who are aspiring to to lead in any area that we are looking for. So our gender equality we are looking for, can there be representation of both genders? Here I'm looking at female and male, there could be others, but here I'm talking about trying to have both genders included. If you have one female in a panel of 10, or in an administration, a management of 10, then for sure, even you need to look at it and look, is this a fair representation of gender? So what we are asking for is gender fairness, making sure that both genders are included. And here, as I said earlier, is to be able to bring it that eye that could be missing, because there's a way female look at things, there's a way male look at things, so that you have both of them present, so that they can look at things from both sides. Thank you.
Thank you very much. I like this concept of gender fairness as to a tick box idea of gender equality of numbers. Sandra?
Yes, I wanted only to say that to really have the gender equality or equality with all the other issues of misrepresentation, we really need to begin since really early with education. Is the same opportunities at each level in our life. So how can we do that girls can have the same opportunities of education, not only at the primary level, that most of the time there will be the same opportunities, but not the same vision, because most of the girls since primary school, we're already telling them that they won't be able to do some things, or that they're not good to some subjects. So we have to stop this and really have to show little boys and little girls that they can do everything, and each person is different, and you will have more skills of others, but this doesn't depend on your gender, but each us. And this diversity of skills is not bad or good. It's not that someone is better than the other, but this is what makes humanity great. So I think we need to work on this, give them the same opportunity at primary school, same opportunity secondary school, same opportunity at each level. And once they're working, we need to be sure in this fairness of representation, the fairness of evaluation when people are getting over. Because this is maybe one of the reasons, maybe the way how we define science, maybe the way of we evaluated science, what is really good science, what is really excellence of science, what is really excellence in our work. I don't think we are really doing a good job on that now. And this is, of course, we don't have time because it's a long issue, but even if this evaluation was created at a specific time, at a specific kind of scientists, that there were all male and they were all from the North countries. So of course, in this definition, a lot of great scientists won't be designed as great scientists. So we really need to increase these opportunities at each level. And once I think girls, I'm sure they can do what they want, and they will be fairly evaluated at each step, since a little girl to a really old person, then I think we will all really have gender equality. But for this, we need gender equality will go also, with gender, with equality in social, in education and health. Because at least in Latin America, this is a big problem. We have a lot of girls that will miss school or that won't go far in the education because they will have kids really early. So this problem of adolescence pregnancy, and most of the time without really willing it, and most of the time with really older males, is something, at least in our region, is we have to really work on that. We need to protect them and give them also sexuality education, so they are more protected, so they can do all the nice things they want to do in the world.
Thank you very much. I like this idea that we have to to make a step back, to go 2 steps forward, so do the cha-cha. We have to look at our education, at our health, and before we even change the mindset of women and men can do things equally well. So with that, let's close. I thank all of you, all of the discussants, for very interesting contributions. I wish we had more hours to discuss all of these things. And I think when the borders in South Africa open, or those that are in South Africa, when you ever find yourself in Pretoria, we would love to have a continuation of this discussion in person. That would take us hours and hours, and all of these very interesting topics that you all touched. Thank you for your effort. Thank you for your time. Time is a precious commodity. In all of this balance, things are coming up, but thank you for sharing your time with us. On behalf of the SAYAS Exco and all the SAYAS members, we appreciate you all. We appreciate the audience joining us. And from my side, I wish you a wonderful day further. I'll just give over to Edith now for final comments and closing the session. Thank you very much, very much.
So thank you again, Roland, to our panelists. I think we had an excellent discussion, and it doesn't end here. I think these are discussions that need to happen every so often so that the message can get home. And we should not tire to be advocates in our different fields and continue with taking the message forward. So we thank you all. A few questions which you couldn't answer at the moment, I think we'll keep having the discussions, not just within Women's Month, but as we continue the different forums and the different platforms. So once again, thank you to all the panelists, your efforts in the COVID fight for those involved. We wish you Godspeed. Have a good day further. Thank you all. And to all our listeners as well and our participants, thank you as well. Goodbye, everyone.
Thank you. Bye.
Thank you.
Bye.
Bye, thanks.
Thanks.